Good evening. I'm Dr. R. K. Dua. I'm a founder of Fun, Learn, and Earn system for the dentist. Today I will talk about history taking. So, history has got two important aspects associated with it. First is that it helps us in reaching to a proper diagnosis so that we can start proper treatment to the patient. Second thing, this history taking can instill placebo or the nocebo effect in the mind of the patient. So we have to be very careful that we must always instill placebo effect in the mind of the patient so that whatever treatment we give to the patient that has more beneficial effect as compared to the nocebo effect if the patient has some doubt in our treatment or in our behavior. So what are those aspects that we have to ask from the patient? Number one is the name of the patient that gives more confidence to the patient and more, you can say, faith in the patient's mind that the surgeon or the physician has remembered his name, and that means the physician is more concerned about him or his problems. Second is the age and sex of the patient. So age and sex also carries an important aspect that few diseases are associated in the infancy, young age, middle age, and the elderly age. Sex also, where some diseases are more prevalent in male sex, some are more prevalent in the female sex. Then is the address of the patient also carries significance. So all these three aspects, name, age, sex, and the address, also carries medical legal aspect also. We can differentiate one patient from the other patient when we compare all these three facts. The second importance of the address is that if the patient is coming from a certain locality and there may be some disease more prevalent in that area, so we can suspect that patient may be suffering from that disease. Next comes the dietary habits of the patient. Certain dietary habits are associated with certain diseases. So, patient with, you can say, taking more spicy food, taking more alcohol, or you can say the caffeine. So, that patient may be suffering from, you can say, acidity problem, gastric problem. Or then we have to ask from the patients whether the patient is smoker or non-smoker. So this carries the importance that patient may be suffering from respiratory problem, malignancies of the oral cavity or the lungs. Alcohol habits of the patient also give significance that patient may be suffering from liver disease or may be suffering from off and on pancreatitis. If the severe attack of abdominal pain, we can also suspect that patient may be having acute pancreatitis. Then the allergies. So these allergies may be related to the drugs, may be related to the food items the patient is consuming. If the patient is allergic to some drug, we should avoid that drug and we should also mark on the file of the paper or file of the patient that the patient is suffering from this drug, and even by accident that drug should not be given to that patient. Similarly, the patient is or patient may be allergic to some food article. So we must always keep in mind that this patient is allergic to that. So that food should not be given to the patient in the hospital or at home. Second aspect is that whenever such kind of patient who has taken such kind of allergic food at home and develops severe symptoms, so when we ask from the attendants or the patient that whether he or she is allergic to some kind of food or drug, or whether he has consumed that allergic substance, so we can have information and we can start the treatment based on the symptoms of the patient and the drug he has consumed. Then comes the medical history of the patient. That means either the patient is suffering from some medical problem for the last many years, or patient may be taking some drugs which can interact with the drug which we give right now for the existing problem of the patient, or patient may have suffered or may have undergone some surgical procedure, we may that may have some complication right now. So all these things are related to the patient's you can say personal details and habits of the patient and the allergies and the medical history of the patient. Now comes the chief complaint. These are the main complaints for which the patient has come to you in the casualty or in the OPD. So we have to write all these chief complaints one by one in a chronological order. Suppose one problem is for the 5 days, another is 3 days, and one is for 1 day. So we have to write in a chronological order, means the problem with 5 days will come first, 3 days will number second, and for 1 day in a third space. So next comes the history of present illness. So we have already taken three problems from the patient, one, two, three. Now the patient has come to you. So we have to ask from the patient how all those three problems one by one developed, where those problems developed, what the patient was doing, how there and what was the progress of those problems from the onset till the patient has reached to you in the OPD. So that things that you have to, suppose patient is having abdominal pain. So we must have immediately, our mind should go into that, you can say, part of the abdomen where the patient is having the pain. So we should imagine what are the structures present, what are the organs present in that area of the abdomen that can give rise to such kind of pain. How the pain started, what was the intensity, and whether there was a radiation of pain or not, shifting of the pain associated with nausea, vomiting, fever, loose motions, jaundice, everything that we can ask from the patient depending upon the organ we are suspecting could be giving rise to those symptoms. So when we have collected all this information, then we are able to make some probable diagnosis depending upon the history of the patient. So next step will be examination of the patient, and the examination purpose is to confirm the findings of history by doing the examination of the patient. So that examination of the patient we will discuss in the next video. Thank you very much.